Okay, so let's talk a little bit about nutrition. What we eat, does that matter as well from a mental health perspective? And, well, the answer to that is yes, it does. So nutrition and depression. There are a whole lot of foods that actually have beneficial effects for depression, as well as other mental health problems. I'll just focus on depression because there's probably more research in that area than anything else. Omega-3 fatty acids. Have you heard of omega-3 fatty acids? Right? Fish oil, flaxseed oil is another good plant-based source of omega-3 fatty acids. So, for example, there's been a whole series of studies showing that has antidepressant effects. It's a powerful antidepressant. Or put it this way, inadequate omega-3s in the diet puts us at much more risk of depression. What we're correcting very often is not supplementing with excess omega-3s, but just trying to get our body back onto the levels of omega-3 fatty acids that it actually needs to do its job. It's called an essential fatty acid because we need it in our diet. Our body can't make it for itself. If we don't get it in the diet, we don't get it at all. Well, in terms of in the community, I mean, you can try and measure, if you're doing a very detailed analysis of what you're getting in your diet. I don't know how many times you eat fish, for example, and how many times you have a handful of walnuts, and how many times you have a tablespoon of flaxseed oil on you, but you're probably not getting a lot. I know there's been some ads around about red meat and omega-3s. There are omega-3s in red meat. There's not much at all. You probably have to eat about 4 cows to get enough, as much as you might get out of a fish oil capsule. There would be very few people who wouldn't benefit from, say, having 3 grams of fish oil a day. And folate, that's a B group vitamin we get in green leafy vegetables. And many of us are not getting enough green leafy vegetables, and again, that susceptibility to depression. So vitamin D is becoming a major health issue because avoiding sunburn, which is a healthy message, has turned into avoid sun. And we've now got high levels of vitamin D deficiency through inadequate sunlight. We need sunlight to get the adequate levels of vitamin D. So we've actually taken the message, a good message, too far. So we don't need to be sunbaking and we don't want sunburn, but we do need 10-15 minutes of sunlight each day on our skin to convert inactive to active form of vitamin D. And if we don't get enough vitamin D, it puts us more at risk of depression as well. So that is nutrition, and our intake is actually a very important part of our mental health as well. Dark chocolate even qualifies as having antidepressant effects, although mostly short-term, all right? So, and mind you, it's dark chocolate that gets the Guernsey, not because it's got a whole lot of building blocks for all our neurotransmitters. Reducing or avoiding alcohol, excess sugar and caffeine is important for some people with mental health issues. For some people, for others it's not such an issue, but for some people there have been some studies that suggest that excess caffeine can be problematic for, particularly we most note it with anxiety, can accentuate the anxiety symptoms, but it seems to actually have a worsening effect for people with depression as well. Probably because depression often is underpinned by a certain level of anxiety, as is high levels of anxiety often underpinned by significant levels of depression as well. So it's often a mixed picture also. But some people are more sensitive to it than others. Again, a lot of kids these days are just taking in huge amounts of caffeine in energy drinks, and some stage there's going to be a class action about that. Give it another 10 or 20 years when young people have had 20 years or so of some of them downing huge amounts of, I won't name any names, but these energy drinks, and I suspect the cumulative effect on young brains will be significant. And so anyway, that's my hunch. So I think now, this is a study on adolescents, Australian adolescents, and they're looking at dietary quality and the risk of depression. So those kids with the poorest quality diet, basically a fast food, low nutritional value diet compared to the kids who had the healthy, nutritious, varied whole food diet, were 79%. So 1.79 means 79% more likely than average, so nearly twice as likely to get depression as kids with a healthy diet. Okay? So, and they controlled for everything else they could possibly think of, and that was the independent effect of diet. So for kids, a healthy whole food diet may be an important mental health strategy as well. So again, coming back to kids, why? It could be a lot of kids because a lot of kids hardly get any nutrition, hardly any fruits and veggies in their diet, may be putting them at risk. Weight management as well is often linked to mental health issues, and I won't have time to go into it in great detail tonight, but just to mention, if you are interested, Rick Korsman's work in this area, If Not Dieting, Then What, is, I think, an excellent book in terms of giving some very sensible, down-to-earth strategies around the behavioural things and the psychological things that are behind food. Creating guilt around food, not enjoying our food, giving us a hard time over food, comes at a significant mental health cost. If not dieting, then what? The book, If Not Dieting, Then What? He's got a website as well if you're interested in that too. So, but it's certainly got some excellent strategies there. So we don't want our mental health sacrificed in trying to manage weight. So, as you can see, it's very important to get a healthy whole food diet.